Okay. Hi, my name is Dr. Tori Hudson. I'm a member of Pharmaca's Integrative Health Advisory Board, and I'm a naturopathic physician, been in practice for 28 years, and my area of expertise is in women's health, and which includes all kinds of things. One of those is bladder infections. And bladder infections can be more common in different age groups or different situations. For example, women who are highly sexually active, having a lot of intercourse, that can make them prone to bladder infections. Elderly women, when the vaginal and urethra, which is the little tube between the bladder and the outside, changes with drop in estrogen and changes in the organism environment in the bladder and the urethra and the vagina, she can be more prone to bladder infections as well. And then sometimes maybe certain medications or certain chronic health illnesses might leave someone to be more vulnerable to bladder infections as well. So usually though, women might have, 1 to 3 bladder infections in their lifetime. However, some women might have, 3, 4, 5, 6 a year, or even worse than that, every time they have intercourse, they have a bladder infection. And of course, those are the women that are especially looking for important solutions. We hear a lot about probiotics, which are different species of lactobacilli, and we're I think many of us tuned into how that affects our intestinal health, our digestive health, and maybe some things about our immune system. But what you might not know is those same creatures, those same bugs, determine our vaginal health and our bladder health also. And so it's a very important issue in women who are having chronic recurring bladder infections. So that's one thing I actually want to start with, is actually using lactobacilli supplementation to help prevent recurring bladder infections. And it gets a little tricky here because we don't want just any old lactobacilli supplementation. We want one that has some bladder and vaginal specific species of lactobacilli. So Lactobacilli reuteri, Lactobacilli rhamnosus, Lactobacilli crispatus. These are just a little, and some Lactobacillus acidophilus, although that's not the most dominant species in this part of our body. So there are supplements that have these bladder and vaginal specific strains or species of lactobacilli that they have at Pharmaca, and those are the ones we want to look for, which are not the same exact combos that you want for intestinal health, for example. So that sort of sets a good foundation. If we can have a good environment within our bladder, then when we're exposed to the infection-causing bacteria, these normal inhabitants help block the infectious bacteria from kind of setting up shop. And the most common one is E. coli. So if we have these good, strong, dominant, protective lactobacilli, we can help inhibit that E. coli or other bacteria from causing the infection. So that's the big thing for prevention. The secondary to that for prevention might be Manos and or cranberry extract. It could be as simple as cranberry juice. It could be a little bit more fancy and more potent. There are individual cranberry extracts and powders and capsules and things. And then there's Manos powder, which is something we don't hear a lot about. But and the dominant research really is with the cranberry and the lactobacilli. But there's a little bit of evidence, but it's a bit more experiential that this Manos powder can be used. So that's kind of a nice little triad, is lactobacilli specific species, cranberry, and Manos. Now if you have an infection, you can use those as well, especially higher dose cranberry extracts and higher dose Manos dosing. But then we get into, are there herbs that can actually instantly take care of the symptoms within 24 to 48 hours? And there are. And you may not be familiar with some of these herbs, like Oregon grapefruit, Pipsissewa, Uva ursi, Bushu. These are the kinds of herbs you look for in a bladder infection formula, along with the cranberry, and possibly even some vitamin C to keep the area in its normal pH, acidic pH range. So when you dose one of these cranberry herbal combo products, you want to dose it really quite high. So just look at the label. It might be as much as 2 every 2 hours for the first couple days. But again, the staff at Pharmaca can help you with those kinds of decisions. So prevention, we want good hygiene, good post-sex hygiene, lots of water, and the lactobacilli that are specific to the bladder, the cranberry, and the Manos. Prevention, help reducing the frequency and the intensity of you getting an infection. When you have symptoms, burning, frequency, pain, then we want to use higher doses of these things, and in combination, especially with the herbs that have the Oregon grape or golden seal, Pipsissewa uva ursi. So 2 different things, prevention of recurrence and acute treatment. So with that information, I think you'll be pretty well situated. Maybe another question or two when you come to the store, but that information will, I think, set most of you on a good path.